an injury to his lower leg and his knee, and particularly his patella, okay? So there are quite a few views that we're gonna do. Tina, can you give me the leg? Can you give me the actual left leg? Okay, so today we're gonna start off with the chest lift, then we're gonna move into the 4 views of the knee, and then we're gonna concentrate on the patella shots, okay? Because they could be confusing. Think of the chest lift as your forearm. It's a long bone. You gotta include both joints. When you're doing the tip lift, you gotta pay attention to the lateral malleoli because it's longer than the medial malleoli. It sits a little bit lower. So when you do the lateral particularly, you have to have your borderline, your light covering the whole swelling or ball of the lateral malleoli. Also, another good reference when you're doing your collimation top to bottom for the tip lift, you want to do half of the patella. The patella is from here to here. So if you dissect it and you have your light here and you pass the ball of the malleoli, you should be able to get everything on your image. Now, another thing you have to be careful about today is going to be the length of the leg. So because there's 2 ways of doing tip lifts. In the clinical setting, if your detector is floating like this, meaning it's loose, it's not inside of the bucket, you can remove the detector. Then you can work along, diagonally this way. And if the leg doesn't fit this way, a lot of clinics, what they do, they stitch what we call stitch images. So remember how we did the abdomen? You do one long film and then you do a little bit, another one to complement. Same concept here. When you do the tip lift, you want to include the joint that has the pain or the closest where the pain is. That would be your longest film. Okay? Because the last thing you want to do, let's say his injury is right here, and I'm doing the long film in the bottom, and then the little film here, and then in the process I might clip vital information. So if it's right here, somewhere along here, I might start from here down, and then just come down to the ankle, and vice versa. In the clinics, what I have seen is they go from here to here, and then from here to here. So it all depends, but what I don't want you to do is take a full film first, and then do the second film again for full film up. It's like doing 2 KUVs, one here and then the other one here. It's unnecessary radiation, okay? Sir, can you bring your leg up for me? And go ahead and bring it down. So I'm already eyeballing the length of my leg I'm gonna work with, and I'm placing it right corner to corner, okay? And I'm trying to utilize the longest portion of my image receptor. And for Eric, we wanted him to be our model today because he has a very long legs. So whoever is going to go first in Sims, and you happen to have this projection, you have to make sure that the shadow here is not hitting this metal, and that you have enough back side to side and up to here in your image receptor. So he's borderline, I have to tell you right now. Also, when we are doing our tube, we're going to utilize as much as we can our SID. And the clinics, you have the ability to bring the table low and this all the way up, which is really nice, but not here. So let's see how we are doing here. Woo. Let me get that whole thing.
There you go.
Okay. So this is the left, and this is my right. So I'm putting a marker right up here. Watch out for. So I'm going to bring this down just a little bit so I don't hurt myself moving this over. And right here, I'm going to open up as much as I can, and then side to side, you must include the entire soft tissue, unless you're instructed otherwise. And then I'm gonna move my collimator box to align with the body part, and now I'm gonna do as high as I can. So notice how I'm up center. So I'm gonna reposition and just try to get as much as I can. See how he's borderline? And it's okay for you to have light outside like this. So Ms. Sharman feels that he is okay to fit. I'm gonna lift up your legs a little bit. There you go. She thinks he fits nicely. I say maybe not. So as long as you have, see the bending of the leg right here, that bending?
Yeah.
It's inside of your image receptor, and you can see most of the ball right here, the lateral malleoli. I'll say you're in a good positioning. Okay? Do not do this in order to get half of the patella, because this you much rather get this over here. So make sure if you do Eric, you want to have from here to like the bend, the crease right on here. Most people you will reach up to half of the patella, which is about another centimeter. That for him, and because we're limited by the SID, this is as much as we're gonna get. Okay?
You can't
So-
move his like foot down, like this, the penis has to be on the ground.
What's that, Mija?
Do you have to put this part of his foot?
So remember the lateral malleoli, it's
But
this
you
way.
can't move like this one just up a little bit?
No, because you want to make sure that when this is projected, remember as it goes into the corner, it narrows. Okay, so right now what I have is something like this. Oh yeah, not like that. So with our light, I'm barely skimming through.
Oh,
See that
I
little
see.
tip right here?
Yeah.
That's where a lot of fractures happen when they twist their ankles. So if you look at them, as I'm maturing this, not so much up here. So because the joint, as long as I get through here, I get the entire tip. Okay? So I want to make sure that this point, and what I was telling you, if you look at it, this is more higher than this. So you gotta make sure you clear this here. Because if you clip here, you start repeat, or a come down shot. Okay, so that is for, you're gonna do the lateral tip fixer. Oh, no, my bad. Stay how you are. I'm gonna demo really quick. So what you will do is, let's say, patient is having pain over here, your image receptor or your facility only wants you to do lengthwise, not diagonally. So this is what you will do. Flex your toes a little, sir. Not so much. So you place that like you're doing an ankle, and you center it a lot more higher. And then you just collimate in your position to include most of the leg. You see this? So it's kind of doing an ankle AT. And you put the marker and collimate to not clip the soft tissue. Make sense? Okay? Then you will most likely use your detector. Bring your leg up, sir. And then you will come back over here, recenter, knowing, put that, so you remember, you kind of remember here where you did your last image. And then you're gonna recenter to include that part. You see this? Now I'm overlapping both pictures. And of course you will recenter on your image receptor. Get it? And then when the radiologist sees that, he has 2.2 image to reference for the injury. Okay, so now we're going to go to the lateral now. So Ms. Sherman wants me to prioritize on the diagonal version, but like I said, clinics might have you do all of that. Now this is when it gets tricky. He's gonna turn it slightly. I'm gonna give him a sponge for comfort. Right back here. You can relax it back there. Okay. Might help a little. The knee might be bended for comfort for the patient, and also makes it easier on you. Now, when you roll your patient, if you have this leg over, like I was seeing sometimes with some students in the morning, what's this gonna happen? You're gonna have this portion touching the IR, but this is gonna elevate a lot. So you don't wanna have that. You wanna have the leg as parallel as you can. Even if you have OID here, we really don't care for the patella. We're looking at the tip there. Again, see where the corner comes out here? That's kind of hugging your malleoli, that tip right here. So we're doing this. Okay? For the lateral view. And again, we're gonna center with just play with you basically once you position, you sort of boxing your part. Oh, you're fine, son. You're fine. I'm just moving it forward. And see, I'm barely making it to the crease right here. So that's what I say. I think he might fit, he might not fit. We're not gonna know it until we would have taken an image for him. So make sure you just put a nice frame to your body part here, put your marker, and you're done. Easy peasy. The lateral, if you do half and half, that's gonna follow the same principle. You do the longest film and then the smaller film. Okay? Very, very easy to understand that concept. Okay, so thank you very much. Go ahead and turn flat on your back.